Hello and welcome to our special call-in show on coronavirus. Any question that you may have regarding the coronavirus pandemic, any doubts, do call in and we'll have doctors answering all those questions for you. Joining us today, we have Dr. Manoj Goyal, Director of Pulmonology of Fortis Memorial Research Institute. And also joining us from Michigan, we have Dr. Surendra Purohit, vitreoretinal surgeon. Thank you so much for being with us. In fact, Dr. Purohit, I'd like to start with you because we've seen from the beginning of this pandemic, ever since the news broke of coronavirus from China and then spreading to other countries, the directions on the usage of masks, face masks, has been changing quite a bit. And now it's gotten to the point that in the US they're saying do wear face masks, which is something that we've been seeing in many Asian countries. And in fact, in India, I remember when we started doing this show, many of the doctors would follow the WHO guidelines and say, no, the general public do not need to wear masks. Make sure you don't touch your face. In fact, wearing masks may lead to more touching of the face. So tell us about this sort of a change in the outlook that's come about, especially in the US.
Thank you. So you're absolutely correct. In the past few weeks, as this virus has spread throughout the country, there's some controversy on whether there's benefit to the general public wearing face masks. And just today, the CDC has advised that all Americans wear a face mask when they go outdoors. And one of the things that's become obvious now is a huge percentage of patients who have COVID-19 are asymptomatic. And so one of the reasons to wear the face mask is to prevent other people from getting it. And particularly, there's two different ways that the virus can be spread, from the droplet or aerosolized form. And by wearing a face mask, even a handkerchief around the face, if you're an asymptomatic carrier of the virus, it can potentially reduce the risk of you passing it on to the droplets onto people around you. And this is something that the U.S. has come around to a little bit late, but I'm glad we've come around. And, even today I went for a walk outside just a few minutes ago, and I saw people wearing face masks, and they're heeding this warning. I think it's very important, in addition to all the other things that you've talked about, the social isolation and washing your hands, avoiding your face, and so forth.
All right. Well, thank you for that. We have our first caller, and we have Rahul calling in from Hyderabad. Go ahead with your question, Rahul.
First of all, thanks to NDTV for presenting this information.
Thank you.
And I want to ask one question. Can the virus be survived in natural indicators such as turmeric powder?
Sorry, what?
Can the virus be survived in turmeric powder?
In turmeric powder, Dr. Goyal?
Yeah, there is no such study which shows that it will survive in turmeric in particular. But yes, it can survive on surface. But the surfaces which are porous, the survival time is much less as compared to the surfaces which are, shiny and metallic or plastic, where it can survive for days, maybe 7 to 10 days. But in turmeric, yes, it is a possibility, and we have to be careful. That's why the basic precaution is that we must keep washing our hands repeatedly whenever we touch anything, any article. So that's the basic precaution we have to keep following. But if it is going to survive, turmeric is going to survive not more than a few hours. That's what it is, I can say, at the most point of time.
We have Achimd Yadav calling from Raebareli. Go ahead with your question.
Yes, ma'am. I'm Achimd Yadav from Raebareli, sir. Or ma'am, can I just want to know that where that virus originally came from? This came from any animal or any chemical breakdown?
Right, Dr. Purohit, this I think is something a lot has been spoken about the origins of the virus.
Well, I think we have some ideas. It began in the Wuhan province in China, and they have wet markets, as you know, where animals that are not produced at animal farms are used for food. And right now the theory is that this was transmitted from the animal to human in one of these markets.
Right, and talk of it being from bats, that's one thing that we've been speaking about. And but at this point, is it something that's confirmed?
I think, I've read in journals they've been identified potentially patients who would be considered the first patient who may have one of the very early patients who have gotten it from bats or some of the other animals in these wet markets.
And what's worrying is we've heard that the wet markets in Wuhan have reopened. We have another caller, Prachi from Mumbai. Prachi, सवाल पूछिए.
हाँ, हेलो सर
जी.
मेरा सवाल ये है कि हमें आपने बोला कि मास्क नहीं पहना जिनको जरूरत नहीं है, लेकिन हमें नॉर्मल मास्क पहनना है, लाइक कॉटन का, बाहर जाते वक्त, या फिर कोरोना वायरस का ही मास्क नहीं पहनना है, क्योंकि सबको कंफ्यूजन होगा कि हमें मास्क नहीं पहना तो विदाउट मास्क जाएंगे सब लोग, कॉटन का भी मास्क नहीं पहनेंगे.
All right, Dr. Goel, so a lot of, about which type of mask, you don't want to wear the masks that would, take away from people actually working in healthcare and, at the forefront of this fight. But if you could tell us what type of mask the general public should wear.
See, what the WHO recommends is a medical mask. The medical mask is basically a 3-layered mask. There are various kinds of masks available, which can be used by the general public because, the droplet infection can go up to 6 feet maximum. So if you can wear this mask, then it is going to protect you. So any homemade mask, which is made of, cotton or any kapda, किसी कपड़े का बना हुआ mask हो और आपका even handkerchief हो, that can prevent you from getting infected.
So any sort of cloth mask, because I believe in the US also they're now making bandanas and cloths into masks, isn't it, doctor?
Yes. But not N95 mask for the company, not N95 mask. That is only for medical professionals.
Right.
For general public, it's only the normal surgical mask which is available, or कोई भी कपड़े की चीज आप hankies और कुछ भी अपने सामने लगा सकते हैं.
Right. Dr. Purohit, you wanted to add something?
Yeah, I agree with what Dr. Goel says. It's important. In the United States, we don't have enough personal protective equipment for the healthcare providers, so we're trying to preserve the N95 masks for them, even the surgical masks. But it's important because of the high prevalence of the asymptomatic carriers, prevent them from passing on this infection to others, that they cover their nose and face with a bandana or any kind of covering over their face.
All right, we have a caller from Noida. Praveen, go ahead with your question.
Good morning, Ardi. This is regarding the corona survivors. If they get it recovered from corona, is there any chance to get it again, or they develop some immunity?
All right, Dr. Goel, the question about if you recover from corona, I think whether you can get it again.
Yes, you can get it. It doesn't give you complete immunity. Like any other viral infection, you got influenza, you may get infected with influenza again. So that's why even if you recovered from there, you have to continue to practice those infection prevention control measures as judiciously as the other normal people. So that's very important.
All right, and anything, Dr. Purohit, you'd like to add to that?
We might have a little slightly different opinion on this issue. I think there's a lot of evidence that if you have recovered from this virus and you've tested negative, then it's unlikely that you would be infected again. There are some reports of this happening, but those patients, it's not clear whether they fully recovered. And so the general consensus in medicine right now is that once you have the virus and you've recovered from it, then you've developed, your immune system is revved up to fight this virus, so it's unlikely that you would be infected again. In fact, one of the things that would be nice is if we had blood tests that could identify patients who are, healthcare providers who have infected and recovered, then those would be the ones we might put on the front lines, because they're less likely to have the serious consequences we're seeing right now in so many healthcare providers.
All right, so that's interesting. So more research clearly needs to be done on this front. We have a caller from Hyderabad, A.B. Rao. Go ahead with your question.
Hello, doctor.
Yes, go ahead.
Yes.
After the lockdown is removed, again the cases will go up and the situation may go out of hand.
All right. So, Dr. Goel, this is a lot of worry or doubts people have regarding what happens after this lockdown, what happens after 15th April, this all India lockdown that we're seeing, and what sort of care do we have to take then? And I'm sure the government will make this a lot clearer going forward. But yes, Dr. Goel, if you could answer that question.
So it will all depend upon whether we have been able to localize it to some sort of clusters. If it is localized to a cluster, it remains in the local population, doesn't go into the community at large. Then possibly we may be able to limit them, but still there could be only a partial lockdown. We may open up a lockdown, but some areas, some states may still be under the lockdown, because from there, the source of infection can be there, and these people can disseminate infection to others. So we have to see what is how much we are able to control the spread of infection. Because if you see, the studies have been done, if one infected person can infect 2.2 people, so the rest 2 to 4 per person. And if he means 50%, that if we are not going ahead with these lockdown measures, we go about living our life as usual, that this one person is going to infect 1,000 and in 1 month time. And in 2 months time, if we continue like that, this infection would multiply to 1 million. And in 3 months, it will evolve into multiply into 1 billion. So one person can multiply infection to 1 billion people in 1 lakh people in 3 months time. If the lockdown measures are not taken, a total social isolation not taken. So it's a very, very infectious disease. So we really have to see what happens after 15th. Whether it's a community or is localized to certain states or localized to certain clusters, which can then be isolated from rest of the country or rest of the community.
And what the WHO has said during the lockdown by itself is not enough. You need to test, trace and treat the virus. Dr. Purohit, what's been happening in the US, if you could just share with us?
Absolutely. Just to highlight what Dr. Goel just mentioned as an example, about 3 weeks ago, the first case of the COVID-19 virus was diagnosed in our state here in Michigan. And in 3 weeks, we've gone from that first case to 10,000 cases. Just in the last 24 hours, we have 2,000 newly diagnosed cases, and just highlights how rapidly this virus is spreading, how important it is to the social isolation, wearing face masks, and testing people. Like you said, test. And we need to isolate these people, trace down their contacts, and isolate the contacts also. That's going to be the key to controlling this virus.
All right. We have a caller from Bhopal, Yogendra. Go ahead with your question, Yogendra.
Very good morning to you. I'm Yogendra Sharma here from Bhopal.
Good morning.
Doctors, I wanted to ask one question, that virus is spread. COVID-19 has got more spread in northern hemisphere than southern hemisphere. Could you please tell us whether there is any link to the temperature?
All right. This is also something that is really speculated about. First, Dr. Goel?
I don't know. I mean, this may be a trend, but we just have to see how the things are going about, because new clusters are developing, the countries are getting affected. So we don't know. Maybe it depends upon how the people have what kind of people have spread from the original countries like China or maybe from Italy. So we really don't know, and I don't think there is a correlation like that which is proven so far.
All right. And Dr. Purohit, would you like to add anything to this? Because this is again something speculated about. Of course, on WhatsApp, we see lots of these maps being shared, and this talk of hotter countries being less affected.
Yeah, I agree with what the Dr. Goel said. We know other viral conditions like the flu do wax and wane over seasons. However, this virus is new. We just don't have the data. So it's very hard to say whether it would follow that pattern or a different pattern.
All right. We have a caller from Jaipur, a doctor, in fact, Dr. Vyas calling from Jaipur. Go ahead with your question.
Hello. Hi. My question is to Dr. Purohit. I'd like to also say that I know Dr. Purohit. I met him in London 25 years back, and also at his home place in Jodhpur. His father is my father's friend. So, Surendra, I'd like to know that we've been using N95 masks regularly. And as medical professionals, what is the best way? This is because there is an acute shortage of these masks. How do you recommend us if we can, self-sterilize them? People have been saying about, putting them inside, sun for 2 days. Some people say that you can microwave them, but there's a metallic chip inside them. Some people are saying to wash them and dry them inside heat for. I mean, what is your take on this?
I wish I had an answer for you there. I know there are the CDC right now is conducting trials to see what would be the best way to sterilize the N95 mask. So I'm not sure I can give you a straight answer because I don't think we know for sure.
All right, and this
the only way possibly one can do, if you are dealing with the same cluster of the patients, and then you may not need to remove these masks just to preserve these masks, much more. So that is something that you can practice. But as a sterilization and reusing of these masks, we really do not have a clear-cut answer.
Right, but Dr. Goel, it's quite, sad that we have doctors right now, medical professionals in this country really worrying about their own protection, not having access to enough gear right now, given, again, as I said, they're on the front lines of this, and this is a point that has been raised again and again. So, Dr. Goel, do you think enough is being done to provide PPEs to all our, health professionals?
I think presently it may be enough, the kind of patients that we have. But if there is a explosion, the spread of the patient, like any other country, we would also be suffering from this. And the other thing is that what quality of personal protective gears that we have at this point of time. Because in US there are stringent quality measures. You got the NIOSH approved PPEs which have to be used only. Here I don't know what kind of protective measures we have, what kind of sterilization these protective gears we have. So, but yeah, I think presently we may be having enough. Some places it may not be enough, like in remote areas, but in metro cities, big hospitals, there must be enough at this point of time. But if the disease progresses, then we may be falling short, definitely.
All right. And I think this is a challenge both in the United States and in India right now to protect our health professionals. And it's a shame to have doctors worrying about how to, ration their masks or reuse their masks. Well, we have a caller from Kolkata. Anjana, go ahead with your question.
Yes, good morning to the honorable team. I would like to know that how after the 15th, the lockdown is over, how often do you have to wear a mask going out in the crowd? Because yesterday I just went down to the vegetable vendor, he wasn't wearing one. So when I asked him why he isn't wearing this, he said he doesn't have one. And I did look around to see that there were quite a number of people loitering on the streets without a mask. So my concern is that after the 15th and the lockdown is over, people like us, how often do we have to wear the mask?
All right, Dr. Goel?
I think as the new data and new guidelines are coming up, and we know that the asymptomatic carriers are as infectious, or maybe more infectious than the people who have got infection per se in the initial stages, because then it is believed the infection is more in the throat and not in the lungs. So if you got the infection in the throat, you're likely to spread it to more people, and you may not be having any symptoms. So just from the preventing point of view, I think that DCD has come up with a good idea that anybody who is coming out of the house should be wearing mask, so that if at all is infected, has got no symptoms, may not be spreading infection to others. So that becomes very, very important. So now how long you have to use? Again, we have to see what is the level of the epidemic that we are having locally in the community and country-wise. So possibly even if the lockdown is out, we may have to continue coming out with some sort of a protective gear for quite a bit long time.
All right, we have a caller, Arun from Hyderabad. Go ahead with your question.
Yeah, doctor, I would like to know whether this is airborne declared disease or not yet, because droplets do carry it, and they are traveling, they are in the air for a long time. So how do we handle it after that?
All right, Dr. Purohit, again, this is a question, that keeps coming up, and the whole issue of aerosol and how long it stays in the air around a possibly infected person who may be asymptomatic.
Sure. Well, I think much of it we don't know for sure, but it's becoming increasingly clear with the high number of asymptomatic carriers who are passing the disease on, who are not sneezing, who are not coughing, that there's clearly an element of aerosolized particles affecting, causing the spread of this disease. The question is, what does that mean? Is it 6 feet? Is it 10 feet? And we don't know. What should you do when you're walking outside and somebody walks by you? Is there a possibility they can give you an infection? And I think these are things that we're still looking at, and we don't know the answers to. I think the best precaution is to, in this current situation, the whole world finds itself, is to wear a mask if you're outside and assume that there's some element of spread through the aerosolized form.
All right. We have another caller from Srinagar. Hussain, go ahead with your question.
Yeah, I want to know that as the study says that this virus stays in air for 2 hours. So, is it safe to move around the walls of the house?
You're worried about moving around in your own house?
Yeah.
That it stays on surfaces?
Yeah.
All right. So, Dr. Goel, how does one protect themselves within your own house, and what should one do?
See, again, we have to maintain social distancing within house and maintain a distance of at least 6 feet to 2 meters from each other. That becomes very important. You have to practice the cough sneeze etiquette, very, very important. The other thing is you have to keep cleaning your surfaces, particularly the areas which you touch more frequently. For example, the knobs of the doors or the washrooms, there the cleaning has to be done very, very frequently. So this usual social precautions which are advised for all the persons out of the house is also applicable within the house itself.
All right, we have Prasad Rao calling from Hyderabad. Go ahead with your question.
Compared to other viruses, whether coronavirus at very low load can cause disease? on this. Hello?
Yes, go ahead. Sorry, it wasn't very clear. Go ahead.
Compared to other viruses,
yes,
whether coronavirus will cause the disease at very low load?
Okay, Dr. Goyal, first corona, he's talking about the viral load, I think, of coronavirus and if it has a low load.
See, presently the problem is that it is the new virus and we do not have immunity against it. That becomes a very important issue. And we actually do not know whether load really makes a difference. But possibly, yes, theoretically speaking, somebody is carrying a larger viral load is likely to be more spreader, causing more infection to others. So, I mean, whether the load is more or not, basic thing is that we do not have immunity against this virus. We cannot kill, our immune system may not be able to kill this virus, like many other viruses that go inside our body. So we have to continue with the protective measures which are outlined.
All right. We have a caller from California. All right, we're trying to get that caller, but I also wanted to ask about testing, doctors, because there are various tests that are being talked about. Some are, quicker, some are antibody tests. Dr. Purohit, if you could, talk a bit about that, because even here in India, we're trying to access more testing kits.
Well, that's a good point. And one of the problems has been how long it's taken for the nasopharyngeal swab testing to be done. We've had patients now who have the testing done and they don't get the results till a week later. I'm familiar with patients who had the testing done. They end up in the hospital admitted, and then the test results come up after the hospital's already done the testing. So one of the big dilemmas for us is to come up with new methods of testing that are faster. In fact, here in Detroit, some of the rapid test kits have just been approved, and this will potentially be a game changer because it will allow us to identify those patients and isolate them before they are able to spread the virus further. And the FDA here, which is the government entity that helps approve these tests, is really fast-tracked many of these companies to develop the testing. The big concern here is with all these different companies coming up with testing methods, how accurate are they going to be? What is the false positive rate? What's the false negative rate? And so forth. And all of these are in rapid flux. Things are changing day to day. But that's going to be the key thing, to develop an accurate, rapid test which can give us the results within a few minutes potentially.
All right, especially and the same challenges facing us here in India as well. Well, thank you so much, Dr. Purohit and Dr. Goyal, for taking all those questions and clearing so many doubts for us. Thanks so much for all the viewers who called in and those of you who are watching. Well, with that, time for us to slip into a break. Goodbye.